Health workers' dependents coming to UK falls by 70%. Published by the Telegraph. Amid the visa crackdown, the number of applications has fallen from 75,000 to just over 20,000. A crackdown on health and care worker visas has slashed the number of dependents they are bringing into the UK by 71%, Home Office figures show. The number of visa applications from health and care worker dependents fell to 22,200 between April and July 2024, down from 75,300 for the same period last year. Meanwhile, 2,900 people applied for a health and social care visa in July, down 82% compared with the same month in 2023. It followed curbs introduced by Rishi Sunak in March this year that barred health and care workers from bringing dependents to join them in the UK. The number of UK study visas also dropped 16% in the first 7 months this year, compared to last year. Meanwhile, the number of applications for student dependents is down 81% over the same period. Although applications for UK study visas peaked in July at 69,500, the summer spike is largely owing to a flurry of applicants ahead of the start of the academic year and is down from 81,900 the previous year. In total, work, health and study visas for main applicants and their dependents over the first 7 months of 2024 have plummeted 34.7% compared to last year, down from 353,300 to 541,200 over the same period. The former Conservative government's measures were designed to crack down on people coming to the UK for low-paid care worker jobs, which undercut British workers. Applications for health and care worker dependents peaked at 23,300 in August 2023 and have been decreasing since December 2023, falling to 5,100 in July 2024. The measure formed part of a package of policies, which also targeted applications for skilled worker and family visas, aimed at reducing net migration by 300,000 after a record high of 745,000 in 2022. This was nearly 3 times the pre-Brexit level of 250,000 and blew apart the Conservative manifesto pledge to reduce net migration. No plans to change rules. The Labour government has said it has no plans to change rules barring health and care workers from bringing their families to the UK on their visas. However, care providers have warned that tougher restrictions on overseas workers and their families risk exacerbating a recruitment crisis for carers. Dr. Jane Townsend-Obe, CEO of the Home Care Association and chair of the Care Provider Alliance, said, "Recruitment into care roles within the UK remains tough because councils and NHS bodies don't pay enough for providers to offer competitive wages. The number of British nationals in the workforce has decreased by 70,000 over the last 2 years. In the short term, we thus also need ethical international recruitment." Home Office rules mean it is now almost impossible for care providers to meet the criteria to recruit from overseas. The resulting fall in visa numbers risks a lack of availability of care for those who need it. A Home Office spokesperson said, "We have set out a clear plan to bring down historically high levels of legal migration by tackling the root causes behind high international recruitment. By linking immigration, labor market, and skills systems, we will ensure we train up our homegrown workforce and address the shortage of skills. Immigration brings many benefits to the UK, but it must be controlled and delivered through a fair system." James Cleverly, the Shadow Home Secretary, said, "Today's data continues to show my stricter approach is working, with student and healthcare dependents banned and skilled workers and family visas requiring much higher earnings. Visa applications are down by more than a third where we took action, but Labour want to put this all at risk. They have already binned our Conservative plans to raise the earnings threshold for family dependents, while their ministers openly advocate for lowering EU visa restrictions. They never cared about controlling our borders and they will leave the British people to pick up the bill."